Dr. Arveen Bhasin. She is an instructor in medicine in the allergy department. She's the medical director of our allergy department, and she specializes in food and peanut allergy. She's got some cases in pediatric allergy for us. Dr. Bhasin.
Good afternoon. I'm sorry I don't have an interesting model but I don't think you want to see anaphylaxis either. So, okay. So I have two talks. One is on peanut allergy. The other one's on penicillin allergy. So peanut allergy. Peanut is one of the most common. Sorry, I was just coughing. One of the most common food allergies, along with egg, milk, soy, wheat, tree nuts, fish, and shellfish. Peanut actually belongs to the legume family. Tree nuts are your other nuts like almonds, cashews, walnuts, pistachios, all that other stuff. So peanut allergy is a huge problem. The prevalence has actually increased in the Western countries over the past 10 years. It's from about 1.4 to 3%. It's the leading cause of anaphylaxis here in the United States and in the UK. And it's the leading cause of death from food allergies. It develops early in life. It's rarely outgrown. 80% of kids will outgrow their egg, milk, soy, or wheat allergy. Unfortunately, only about 20% will outgrow peanut, tree nut, fish, or shellfish allergy. So it tends to stay with the majority of them. Of course, in this day and age, we still tell patients strict avoidance, and that is really the best way of losing their allergy. But despite that, they still tend to hold on to it. And back in the early 2000s, the guidelines were for the recommendations that we were telling parents were to stay away from it. Absolute strict avoidance for at least 3 years of age. That was our best recommendation in order for children to hopefully avoid developing a peanut allergy. So when patients would come in or parents would come in, we'd say, stay away from it. Hopefully then your child won't develop peanut allergy. But then the studies showed that that didn't actually help. We still saw a huge increase in the development of peanut allergy over the years. And so in 2008, they came back and said, stop recommending delayed introduction. It's not helping. We're still seeing the huge increase in the prevalence of peanut allergy, both in Europe and here in the United States. And so everybody sort of went back to the drawing board and said, well, what do we do? This is a huge problem. And it was really interesting. Around 2010, some British researchers started to notice that some of the patients that they were seeing who were of Jewish ancestry in Britain had a higher